Welcome to Aesthetically Speaking 2026. And today we are tackling one of the biggest questions in modern medicine. Not just how long we live, but how well we live. With social media, AI, DNA testing, wearables, and endless health advice flooding our lives, it's never been harder or more important to know who to trust, what to trust, and how to personalize health. We're joined by the team behind Longaevitas Health, a platform designed to shift medicine from reacting to illness to actively planning for your longevity. And we'll explore what it really means for patients, for doctors, and for the future of healthcare. Welcome, Dr. Kapur. I'm going to start straight away by asking you to clarify the difference between lifespan and health span. Living longer is great, but only if we are living in a healthy way.
So I like to start with a tagline, which is we're not just trying to add years to your life, we're trying to add life to those years. There's no point being 100 years old, but you don't have the independence, you don't have the cognition, and you don't have the ability to function as you want. That's really what Healthspan is. We want to increase people's ability to be independent, to be functional for as long as they can. It's not about living to 120 or 130. It's really about living as well as you can for as long as you can.
And that makes me think of those documentaries that were aired last year that made headlines, the one being The Secret of the Blue Zones, all about centenarians and the commonalities that actually pulls it all together. No matter where you're living in the world, what these centenarians are actively doing, in what they eat and how they move, in the community they have. And then there was the rather extreme quest to defy aging, and that was the man who did not want to die or don't die.
Yeah.
I think it was Brian Johnson who was taking 100 supplements a day and doing these extreme sort of testing and exercise regimes. And that's not sustainable for the normal person. What do you think about that?
So I always like to come to, I guess, a bit of a balance. So one is really trying to push the scientific frontier of what is known and what's available. And the other is also looking at our own history, which is very diverse, of how people are getting to those longer ages, those longer lifespans, and what they're actually trying to do. I ultimately think that a good mix of both is going to get us there.
Middle ground.
Unfortunately, the boring answer, yeah.
Is another thing that we actually spoke about earlier was that since COVID, social media has exploded with health advice from influencers who, let's face it, are not medically trained. Do you think that has created confusion in healthcare?
Yes, definitely. I think that since COVID, we've seen an explosion in the general health space, and that's for bad, but also for good, right? And that's what I'm really wanting to focus on, is that there's so many more people now interested in their health. They're interested in making better decisions. Now, what we really want to do is make sure that doctors are in charge, I guess, of that wellness revolution, to make sure we're getting evidence-based medicine into these decisions, so that it's not just, I guess, trying to sell something or some supplements or something like that. It's actually done in a coherent manner where, yes, okay, maybe I do need some supplementation or I need some specific prescribed exercise, we have to work it through in a holistic manner.
So in your view, there isn't a one size fits all to your health plan?
Not at all. I think that's one of the points that we're trying to fix, is that we want personalized and preventative care. If you're not personalized, then it's just generic advice that we're giving, and there's no value in there. And ultimately, we want to make outcomes better. We want to really improve them, and that has to be done on the personal level.
So in terms of mentioning COVID as a problem, what other problem in healthcare made you want to build this platform?
I think noise. And I know it doesn't sound like that specifically, but it's just there's so many different tools we have available to us now, and patients are increasingly equipped and they're understanding more about their health, but it's not in a completely holistic manner. And with that, doctors are having to deal with increasing amounts of data, different streams of data, and trying to actually give plans based on that. And they don't teach us that in school. They don't teach us to look at your wearable and look at that in context of your bloods and then now calculate your cardiovascular risk. And it goes, no, go down there. Mm-hmm. What we're really trying to do is make sense of it all and give a very unified vision of where we can take healthcare.
So in simple terms, what is Longaevitas Health platform and how does it work?
So we're a platform that is doctor and patient facing, right? For the doctors, we use our platform to integrate information. That's your bloods, wearables, genetics, microbiome analysis, imaging, anything that you have, we can use because we want as many snapshots of you as we can get to understand your biology. Then we also have the ability to generate really personalized insights based off of that. Now, we also have to equip doctors with the ability to translate those insights into actual action plans. And then the doctor's clinical judgment can really come to the fore to help manage you through that. So ultimately, the management stays with the doctor, but we just help support them in that journey. Now, on the other side, we also have the patient-facing side. So the patient-facing side is really about engaging the patient with their doctor. So you have all of your health data in one place. You have your inbuilt AIs to understand your own health data and to even ask questions to help you set up a diet plan, but based on your bloods and microbiome analysis, Mm-hmm. So we get to use all of that information there. And then we also have your metrics like your, biological age, your rates of aging, your heart age, just to give you some more metrics to keep you involved in understanding your own health.
So all the tests that patient might have done or is going to do, any blood tests and that, all that gets sort of, what would you say?
Yeah, uploaded on.
Yes, 100%. The platform. And is this platform all right for everybody across demographics, all ages?
Yes, 100%. So that's where the personalized element comes into it. So we are able to deal with all patients because we deal with your biology. So we take that specific look at you, and then we want to make sure we get you into your best health. We are open to every single person at pretty much every single age also.
Below never 80. Too late.
Look, it's never too late
to start.
Really what we want to get across is that when you want to, let's say, invest in the bank, or you want to, invest some money, you don't like to start investing at 75. You like to invest when you're younger. You like to invest when you start earning. And that's really where we see those compounding gains take place. So that's why we do want younger people, we want middle-aged people, we want elder people, we want everyone across the board because they all stand to benefit. But ultimately, we want the middle, right? That's really where we want, because those patients aren't engaging in their acute care, or there may be colds and flu, they'll go to their doctor. Chronic care, they might be a little bit older, but that middle, that's really where we can make a big difference.
Yeah, I like the analogy of it's an investment.
Yes.
It is an investment. But okay, so let me just be a little bit controversial and say, you know what, I'm really, really healthy. I've got a wearable. I have Dr. Google at my fingertips. Why do I need this platform?
That's the exact sort of person that we want to deal with, right?
Okay.
Because people assume that they're healthy, but we don't deal in assumptions, we deal in data. So that's exactly what we want, is that we want people who are healthy to come to us to really understand their health, because unfortunately, it's not just a wearable that's going to make you healthy. It's not just thinking that you're, eating well or exercising that will make you healthy. Maybe you don't fully understand your actual cardiovascular risk, or your diabetic risk, cognitive risk, or your renal disease risk. So we have to make sure we properly look at your health, understand your risks, and then you can have the stamp to say, okay, no, I'm healthy. I've dealt with my risks, right? So assumptions is what leads to bad outcomes. We want to really have it data-driven.
And genetics also has a huge impact on this. And all right, so again, on the road of being, controversial and playing devil's advocate, what about the young person who invests in this, and with all the tracking the nutrition, the exercise, the supplements. What if they become really obsessive? Or is this going to bring a little bit more focus and clarity?
So definitely the latter over there. We've seen a lot of health anxiety and health neuroticism on the, it's on the rise because ultimately it's that noise. We're getting so much different information from so many different sources, right?
Flooded.
It's just about making sense of it and using it for your benefit, not using it for your harm. If you're stressing about your health a lot, that is actually going to have a very, very negative effect on
mental health.
We want to give people peace of mind because people want to be healthy, but it is a subject which gives them anxiety. Sometimes not knowing it gives you an anxiety, so you don't want to deal with it. Knowing too much about it will also kind of give you an anxiety. We want to try, I guess, find the balance where we're getting the biggest bang for your investment, emotionally into your health, so that it doesn't become a huge, doesn't become like a huge problem or in the back of your head the whole time. You're like, okay, no, I've done what I've had to do. I'm confident. I have peace of mind in that. I move on.
Yes, it's like if I take, this is on a personal note, I mean, if I do my exercise routine in the morning and I'm relaxing in the afternoon and all of a sudden my smartwatch says, time to twist. And I just think, well, no, I don't think so, buddy. I'm reading, So there's a balance there, but just thinking about the kind of the obsessive person, it could become a problem. But as you say, if knowing what they've done and being secure in that knowledge that you've done enough for today and that you're on the right track, I guess then it does bring a focus and clarity.
100%. I really, really agree with that. I mean, that's really the goal, is that we have to deal with humans. We're not dealing with robots. We're not dealing with machines. But what we're trying to do is bring a sort of engineering aspect to biology. The moment we do that, we can understand it a little bit like a machine, but it's not for the purpose of bombarding you with information. It's just with the purpose of getting you healthier. We're trying to take away that anxiety. That's really what we're trying to do.
And fear and not knowing are two, I think, fear and ignorance are two of the greatest scourges for human beings. Rather know and have a plan and know what to do to optimize health.
And I think even actually one thing on that subject is that when you have different, I guess, forms of testing, and we've had it where I think people want to know more about themselves. So they'll do a genetic test, or they'll do a microbiome test, or they'll have some other form of testing that they've done. But ultimately, it's not actually being translated into better outcomes for them. And then it just adds to the noise. So it's like, okay, I've done this genetic testing, but now I don't know. It's another thing that I've done now, I don't know. So we're really trying to bring in a layer to absorb all of that and to actually give you actionable advice really based off of that.
And that brings me to another interesting point, that sometimes with genetic testing, you're told that you say you have a propensity towards breast cancer, or you could have diabetes, in your makeup. But we can reverse some of those things in our lives. It can be reversed. High blood pressure, for example, that can be reversed, and not just with medication, which there's always a place for medication, but with proper lifestyle change, that can be reversed.
It is very, very true. So for chronic disease, people think that chronic disease happens to them and not within them. Yes. So this is something why they feel like they don't have control over it, right? Yes. And if you're not working with a professional, you might do a genetic test and say, okay, I'm going to have diabetes. And while the genetic testing is very important to tell us, okay, about your risk profile, it doesn't tell us you have to end up over there. So what we're trying to do is just look, your genes are a guide, but ultimately lifestyle is really the trigger which is going to get you to where you're going to go. So we want to make sure that we have interventions there, whether they're pharmacological or non-pharmacological. Those are just tools to get us to your healthiest point. Yes. Whatever we have to do, we have to look at side effects, we have to look at the positive and the negatives, but ultimately the goal remains the same, but the path for everyone might be different.
Let's talk about misinformation. How do you stop misinformation from going onto the platforms, given what you see happening with influencers?
I think for us, it's about better information. So evidence-based medicine is something which is core to the platform. And we have to make sure that the interventions, I guess the doctors are doing are all evidence-based. And we also have to make sure that we are really referring back to literature and also just common practice understanding of how we're going to get you into your best health. So making sure that we're looking at the data, that's really the key, but also keeping you within that ecosystem where you're working with a medical professional, where you're working with someone who really understands your health and someone who understands medicine. That's really front and center to us.
Yes. And that's also going to help with something that really, really worries me terribly. Again, on social media is the supplement advice. And all of a sudden, everybody is taking this for their hair and this for their skin and this for their digestion, and the microbiome is coming into it. And it's overwhelming because everyone's telling you to take such and such a powder or a pill. How does Longaevitas Health platform decide what someone really needs to take and what they don't need to take?
I think, again, it comes into that data-driven approach. So when we're looking at patients and when we're understanding you and your biology, we have to see what you need. But for example, supplementation could be like, okay, these are my bloods. If I have a microbiome analysis, that's great. If I don't, it's also fine. This is in general like my health picture.
Yes.
Now, let me make a diet based off of that. So once you have the diet sort of based off of that, then you can see, okay, you can ask the inbuilt AI, what am I missing? Is there anything that I'm missing from my diet? So then you can say like, okay, I've analyzed the amounts of what you're eating. And then I can see that maybe you have maybe one or two things that you might be deficient in. So how about this? I can suggest you shift this and that food to help you get that. But if not, you also know what to supplement then. So you have direction in what you're doing. So really it's about that personalization.
And it's coming back to that thing that not one size fits all that we spoke about in the beginning. So if your friend might be taking, biotin for their hair, you might not need it because your sandwich contains all the biotin for lunch that you need.
Yes.
Okay, let's focus on doctors because this platform needs to have the doctor working with it. Why should a GP or doctor in any other specialization, why should they adopt this platform? What actually changes in their day-to-day?
So I think one thing that we've seen is that we have acute care, right? So your colds and your flu where you're going to go to the doctor. Then you have another subset of patients who might be a little bit older and have chronic conditions who will also maybe be going to the doctor. But you have this middle. And now this middle is expanding both ways. And what we're seeing is that this middle is not having touch points with the medical system. And there's two issues there for doctors in general is that one, firstly, they're not going to be in their best health. And two, if those patients are not coming to see you, you're also not seeing them. It's also revenue. So doctors, our job is to help patients and to make sure that they're in that ecosystem. We have to give them a reason to have those touch points. We can't just say, okay, no, just go and get your health checked. We're like, okay, let's have a structured approach to preventative care so that, yes, you may not be sick right now, but let's actually see and track. Let's make sure that that little drift that happens now, which turns out to be diabetes in 20 years, let's catch that now. Let's treat that now. So we give doctors a framework to really treat that and to access these middle sort of patients so that we can get them in the system. They're doing appropriate testing, ethical testing, and that we also have them generating revenue for the doctors. So we're trying to inject more value into the system for doctors and for patients.
All right. And just speaking as a woman, you have changes occurring throughout your life. So the fact that you feeling well at this period in your life might change in, say, 5 years' time or 10 years' time. There's constant flux and change. Let's look at how then this helps doctors earn more ethically without feeling that they are selling.
So we think that it's not really selling or upselling to patients. It's offering patients preventative care with a proper structured framework, that guarantees and pushes them into their best health. It allows them to fully understand their risks, deploying all the tools that we have available to us now, because, patients have AI now. So
Yes.
doctors also should have safe and compliant AI that helps them with patients to make sure that they're really, really looking at, I guess, from the nitty-gritties to the real big picture to make sure we're targeting their health holistically.
So patients have their own AI, but doctors have a more specialized tool.
I think
Am I understanding that?
so. It's about making sure that we layer. So with that, it's just about integrating information, right?
Okay.
But what we have to do is translate that integration of information from just noise into action. That's where we are helping doctors, because ultimately it's just going to continue on where we're just going to get more and more and more information. But is that actually going to make the patients healthier? Is that actually still giving them structured frameworks and approaches to their health? That's what we see as a potential issue. And that's where we see Longaevitas Health really helping doctors.
All right. And they keep their clinical responsibility then?
Yes, 100%. So we show doctors how to use the platform as a tool to, yes, generate more revenue, how to add services to their own practice, which will be value added. Then we also, in that too, have a lot of education. So I wanted to touch on that too. So we have a lot of education about the most up-to-date, for example, with cardiovascular risk, right? The most up-to-date risk scoring and profiles, which we do for our patients to make sure that they truly understand. So even things that may not be being tested right now, some of these things are not even on the lab forms. They have to be written in a special test, but making sure that we're getting those. We have our insulin resistance. We have weight management. So doctors who want to be offering structured and medically sound weight management for their patients, they now have a very easy to use tool to help them in that process. Yes. And keep their patients engaged. So again, we're trying to really broaden that offering for what doctors are able to, for what they're able to do. But ultimately, they're still the ones in charge. The doctors make the decisions. Yes. We are the ones just helping them on that journey, but they're the ones making the decisions and they stay liable for their patients.
Yes. And on that point, I think it's really, really important that the general public just know that there's so many fake doctors out there, especially in the aesthetics realm, fake injectors, medical devices that are not sound, that haven't got that clinical trial behind them. And so something like this would actually just take away noise, as you say, and bring focus onto the real, point in question, which is personal health and the optimization of it. Let's be a little bit more philosophical now. Okay. Your website calls Longaevitas Health a love letter to medicine, and I love that. So shifting care from, as we spoke about, reacting with fear to illness and instead planning your longevity better. What does this mean to you?
So I guess when we put that in, it was probably a bit of our personality coming out, but it's really just, this is our way of expressing our gratitude when it comes to, I guess, even the work that we put in, the work that people put in on us, to teach us and to really show us and guide us, the privilege we had to work on patients too, sick and healthy alike. So this is taking all of that experience and then also mixing it with the future of medicine, right? And trying to give current medicine or the current system a tool to really offer medicine at a higher care, better healthcare, preventative healthcare. And I'm pretty sure that is where medicine is going, but someone has to get it there. This is our attempt to do so.
And that you jumped my next point, but it was looking ahead. Say in 5 or 10 years' time, what you hope that healthcare looks like, because of your platform.
Yeah. Primary care should be preventative care. This is the biggest hill that I will stand on or die on, or what it is that primary care should be for prevention, and specialist level care should be when we have to escalate when it's required, right? But really, primary care is where we see patients. That's the interface that patients have with health. if we're not getting through to them at that point, if we're not helping them with health at that point, we're not giving them structured frameworks and we're tracking them and monitoring them and pushing them into their best health, we're ultimately going to end up with the system that we have now crumbling further, right? We're seeing people with a lot of unfortunate negative touch points with the healthcare system because they're coming at a very late point, and now there's more people because primary care is not keeping those people as healthy as they could be. And now we're seeing hospitals full, EDs full, we see these things, and ultimately we have to try and make a more sustainable system and a more sustainable model. And we have the tools available to do so. It's just about implementing them in the correct manner. That's really where we will win or lose. And that's what we're trying to focus on.
And I think the general public, we have to stop self-prescribing, self-medicating, self-dosing. This it doesn't have a part in optimal health. It's been really enlightening to have this conversation. I hope the viewers will be as inspired as I am and as invested in their health, and will see the value that Longaevitas Health platform might have on their personal journey towards really, really good health and living well for longer. Thank you for joining me again today on Aesthetically Speaking, Doctor.
Thank you so much for having me, Paula.